Hello everyone, welcome back to RN Coaching, and this slide is going to be angina. This is our second slide, and thank you for all the support that I received on RN Coaching yesterday. Did not know how to post, but I guess I'm just going to post all the material that I have, which is all of them, and I'm not going to omit any of my content. So basically I'm gonna give you my entire notes. Chest pain, that is angina, is basically chest pain, and the reason behind this chest pain is usually inadequate myocardial oxygen supply, and also due to the narrowing of the vessels and plaque accumulation in the intimal lining. Okay, so this pain is due to, one, the lack of oxygen, inadequate myocardial oxygen supply; two, the narrowing of the intimal lining in the arteries due to plaque accumulation. All right. Some of the in some questions, angina pain, chest pain, they will be referred to as substernal pain, crushing pain, compressing pain, pain radiates to arm and jaw, pain usually after exertion, exposure to cold, emotional excitement. It is referred to in the question. That is actually, they're referring to chest pain. And when this chest pain happens, the symptoms from men to women vary. The women may experience a different kind of pain and symptoms. Some of them are indigestion, back pain, and their substernal pain is less severe than in men. In men, it really hurts. What are the causes for angina? The causes of angina are activity or disease that increase metabolic demands, aortic stenosis, atherosclerosis, which is accumulation of plaque in the intimal linings, pulmonary stenosis, small vessel disease associated with rheumatoid arthritis, radiation injury, lupus, thromboembolism, and vasospasm. What are the assessments for angina? Assessments for angina are anxiety, the first one. When you have pain, you have a lot of anxiety that you're dying. So that is the first one. Then you obviously have pain. And the third one is, when you have this, you also sweat a lot. You have diaphoresis, dyspnea. You will also feel like your epigastric distress. You will also have palpitations, and you will have tachycardia. Those are the assessments. What are the diagnostic tests? Once you go to the hospital, when you come in for chest pain, they will do blood chemistry with lipids to see where what is your cholesterol levels. They will also do cardiac enzymes. They will do arteriography to see, and it will show plaque. They will also put you on. They will also take an ECG, and if you're going home, they will give you a Holter monitor for 24 hours to monitor, and both of them will show ST segment depression and T wave inversion. Okay, so on your ECG it shows ST segment depression and T wave inversion. More about chest pain, I forgot to mention here. There are of three types. Okay, angina is of three types. One is stable, which basically is it's not very acute. You give yourself a little bit rest, you get enough oxygen, and the symptoms go away. One is unstable, which is also called acute, and the symptoms in here they increase on a level by time it increases, so it doesn't subside. And there is another one which is called prince metal or variant. The pain here is unpredicted. It may occur at any time. That's why it's called prince metal, which is a variant. Okay. What are some other diagnostic tests for that we went through our diagnostic tests? We have, next one is the nursing diagnosis. The first one I said anxiety. The second one is acute pain. The third one is decreased cardiac output and ineffective tissue perfusion. Okay. And the next one would be, what are the treatments for angina? The doctor might recommend low-fat diet, low fat diet, low sodium, low cholesterol, and also if they find out a lot of plaque accumulation, then they might have to do a surgery, which is coronary artery bypass. Coronary bypass graft is also called coronary artery bypass graft. It's also called PTCA, percutaneous transluminal coronary angioplasty. PTCA, that's stent placement. Okay, and you have to keep the patient in a semi-phallus position to get more oxygen inside the body. Okay, drug therapy. The patient is treated with anticoagulants, beta blockers, calcium channel blockers, nitrates. Yes, 4 types: anticoagulants, beta blockers, calcium channel blockers, and nitrates. Okay, some of the anticoagulants are heparin and aspirin. Beta blockers, propranolol, nadolol, metoprolol, atenolol. Calcium channel blockers, verapamil, diltiazem, nifedipine, nicardipine. Okay, nitrates, nitroglycerin, isosorbide dinitrate. By the way, they are very potent transdermal, and they're also, some of them are topical. All right, interventions. We went through drug therapy. Interventions would be assess cardiovascular status and hemodynamic variables, administer O2, assess chest pain, administer pain, and when you administer the medications, if the blood pressure goes below 90, you get a doctor, and if the heart rate goes below 60, you get the doctor. Okay. Rest, semi-phallus position, input-output, low-calorie diet. What are some of the teachings for angina? Some of the teachings for angina is you have to explain them the medication side effects. What are the medication side effects they're going to encounter being on those medications? Then you have to tell them about the teaching. You have to teach them about the disorder, actual disorder. Some of them might not know. You have to also teach them to seek medical attention if the pain doesn't subside after 20 minutes. And you probably know, right? Also, nitroglycerin you have to administer every 5 minutes for 3 doses. Make sure that you remember that as well. And avoid exertion. Exertion could be anything. Also, if they are young and if they're experiencing this pain, and so for them, suggest that any sexual activity be later in the early hours in the morning after good bed rest. Okay, so this is about angina. This is what all the topic contains, and we have gone through causes, assessment, diagnostic tests, nursing diagnosis, treatment, drug therapy, interventions, and teachings. Hope you get it. Please try to share this video with your friends, your colleagues, and any other nursing groups that you're on, and help to spread this, to educate the other people that needs this information. Okay, and subscribe to my channel, Aaron Coaching. Thank you.